Heart failure is a serious condition. It happens when the heart can't pump blood effectively. This can be due to various reasons. One such reason is anemia. Anemia occurs when your blood lacks enough healthy red blood cells. These cells are vital. They carry oxygen throughout your body. Your organs need oxygen to function properly. Anemic heart failure develops when anemia becomes severe enough to affect the heart's ability to pump blood. Without enough red blood cells, the heart has to work harder. This strain can lead to heart failure. Think of it like this. Imagine your body as a car. The heart acts as the engine. Red blood cells are like the fuel. Without enough fuel, the engine struggles to run. Similarly, without enough red blood cells, the heart struggles to pump. Understanding anemic heart failure is crucial. Early detection and treatment can greatly improve outcomes for patients. It's about recognizing the signs and seeking help promptly. The heart is a powerful organ, responsible for pumping blood throughout our body. This blood carries oxygen and nutrients to every cell, keeping us alive and functioning. Red blood cells are the key players in this delivery system. They contain a protein called hemoglobin, which binds to oxygen in the lungs and carries it to the rest of the body. When we have anemia, our red blood cell count is low, or the cells aren't carrying enough hemoglobin. This means our organs, including our heart, aren't getting enough oxygen. The heart, in an attempt to compensate for this lack of oxygen, has to work harder. It beats faster and pumps more forcefully to try and deliver enough oxygen to the body. This extra workload can put a strain on the heart, eventually leading to heart failure. It's like forcing a car engine to constantly work in overdrive. Eventually it will wear down. Anemia can affect the heart in several ways. Firstly, it reduces the blood's oxygen carrying capacity. This forces the heart to pump more blood to deliver the same amount of oxygen. Secondly, anemia can lower blood viscosity. This means the blood becomes thinner, making it easier for the heart to pump. However, this also means the heart has to pump more frequently to maintain blood pressure. Thirdly, severe anemia can lead to a condition called high-output heart failure. This occurs when the heart pumps out a large volume of blood but cannot meet the body's oxygen demands, leading to symptoms of heart failure. Imagine a delivery truck that can only carry half its usual load. It would need to make twice as many trips to deliver the same amount of goods. Similarly, an anemic heart has to work much harder to deliver enough oxygen to the body. Over time, this constant strain can weaken the heart muscle, leading to heart failure. Understanding how anemia impacts the heart is crucial for recognizing the seriousness of this condition. Anemic heart failure arises from a combination of factors. Identifying the root cause of anemia is crucial for effective treatment. One common culprit is iron deficiency. Iron is essential for producing hemoglobin. Without enough iron, the body cannot produce enough healthy red blood cells. Other nutritional deficiencies such as vitamin B12 and folate deficiency can also lead to anemia. These vitamins play a crucial role in red blood cell production. Chronic diseases like kidney disease, cancer, and inflammatory conditions can also contribute to anemia. These diseases can interfere with red blood cell production or survival. Blood loss, whether through heavy menstrual periods, internal bleeding, or injury, can also lead to anemia. The body loses red blood cells faster than it can replenish them. Identifying the underlying cause of anemia is crucial for tailoring treatment to address the specific problem. A thorough medical history and diagnostic tests are essential for this purpose. Recognizing the warning signs, symptoms to watch for. Anemic heart failure can be silent in its early stages. However, as the condition progresses, it can manifest in noticeable symptoms. Fatigue is often an early sign. The body is not receiving enough oxygen, leading to a feeling of tiredness and weakness. Shortness of breath, especially during physical activity, is another common symptom. The heart struggles to pump enough oxygen-rich blood to meet the body's demands. Palpitations, or a feeling of a rapid or irregular heartbeat, can occur as the heart tries to compensate for the reduced oxygen supply. Other symptoms may include dizziness, pale skin, cold hands and feet, chest pain, and swelling in the legs and ankles. It's important to note that these symptoms can also indicate other health conditions. Therefore, it's crucial to see a doctor for a proper diagnosis if you experience any of these warning signs. Diagnosing anemic heart failure requires a comprehensive approach, combining medical history, physical examination, and diagnostic tests. A doctor will begin by asking about your symptoms, medical history, and any medications you are taking. They will also perform a physical exam, listening to your heart and lungs, checking for swelling and looking for signs of anemia, like pale skin. Blood tests are crucial for confirming anemia and determining its severity. A complete blood count, or CBC, measures the number of red blood cells, their size, and hemoglobin content. Other blood tests may be ordered to identify the type of anemia and its underlying cause, such as iron studies, vitamin B12 levels, and folate levels. Imaging tests like an echocardiogram can assess the heart's structure and function, looking for signs of heart failure. This test uses sound waves to create images of the heart. Early diagnosis is crucial for effective treatment. If you suspect you may have anemic heart failure, don't delay seeking medical attention. Treating anemic heart failure involves a two-pronged approach: addressing the underlying anemia and managing the heart failure. Treating the anemia often involves addressing the root cause. For iron deficiency, iron supplements or dietary changes to increase iron intake may be recommended. Vitamin B12 and folate deficiencies are usually treated with supplements. In cases of chronic diseases contributing to anemia, managing the underlying condition is crucial. For heart failure, treatment focuses on improving heart function and relieving symptoms. Medications like ACE inhibitors, beta blockers, and diuretics may be prescribed. Lifestyle modifications are also essential. Eating a heart-healthy diet, engaging in regular physical activity, quitting smoking, and managing stress can improve heart health. In severe cases, blood transfusions may be necessary to quickly increase red blood cell count and improve oxygen delivery to the body. The specific treatment plan will vary depending on the individual's condition and the severity of their anemia and heart failure. Living with anemic heart failure requires ongoing management and lifestyle adjustments to maintain heart health and prevent complications. Regular follow-up appointments with your doctor are crucial for monitoring your condition, adjusting medications as needed, and addressing any concerns. Adhering to your prescribed medications is essential for managing heart failure and preventing its progression. Don't stop taking your medications without your doctor's guidance. Following a heart-healthy diet low in sodium and saturated fat and rich in fruits, vegetables, and whole grains can help improve heart function and overall health. Engaging in regular physical activity, as tolerated and in consultation with your doctor, can strengthen your heart and improve your overall well-being. Managing stress through techniques like deep breathing exercises, meditation, or yoga can benefit both your physical and mental health. By actively participating in your care and making healthy lifestyle choices, you can live a full and active life with anemic heart failure. Anemic heart failure is a serious condition, but with early detection and appropriate treatment, its progression can be slowed and symptoms can be managed effectively. Recognizing the early warning signs such as fatigue, shortness of breath, and palpitations is crucial. Don't ignore these symptoms or dismiss them as something minor. If you experience any of these symptoms, see your doctor promptly for a proper diagnosis. Early detection allows for timely intervention and can significantly improve outcomes. Remember, anemia and heart failure are treatable conditions. With proper medical care, lifestyle modifications, and ongoing management, you can live a full and active life. Don't hesitate to seek medical attention if you have any concerns about your health. Your health is your most valuable asset, and proactive care is always the best approach.